Hi there and welcome to the Dawn Show. Dawn Stensland-Menti. We are live and we are local, and today we're talking about the Race for Hope, or better known by many as the Brain Tumor Cure Walk. We want to welcome Dr. David Andrews, who is the neurosurgeon, director, Division of Neuro-Oncology. My goodness, your titles go on and on and on, but absolutely, Dr. David, you are somebody who is recognized in the world for neurosurgery at Jefferson Hospital, which is obviously one of the sponsors of the walk that we're going to be talking about, that we hope people go to on November 3rd. We'll be telling you about that.
Correct.
But welcome.
Thank
Good
you.
to have you here.
Thank you.
So tell me about, so this walk is happening November 3rd, and the Race for Hope, as it is. We have in the studio here a lot of family and brain tumor survivors. And so one of them, 79-year-old Mary, you told her in the green room, well, to be diagnosed with this in 2013, you know, is a great time because of all the advancements that you're making.
Yes, I would definitely say that. So I think with each year, what is otherwise, you know, let's just say it's a very challenging disease, and the triumvirate has always been chemotherapy, surgery, and radiation. And although that still remains the standard of care, we, being the world, are layering more and more biologically specific treatments. Think of it as a smart bomb that's just attacking the cancer cell with no collateral damage to the surrounding tissue. That's where we're all headed. And I think we're seeing now some of the initial beneficiaries of this more targeted treatment.
Which is huge for somebody like, you know, you look at a petite little lady who
Yes.
has this, and so, because oftentimes that was in the past, even 5 years ago, 10 years ago, you know, people would have the treatment and that seemed deadlier than the brain tumor itself.
Yes. So the advances have been really, I think, this particular type of tumor, we were talking about a primary tumor of the brain called glioma. And although this race is devoted to other tumors, this is the one central focus because it's a difficult tumor to treat. The brain is not exactly forgiving. Tumors that grow in the brain tend to invade the brain so that there's no distinction between where the tumor ends and where the brain begins. So surgery itself is an art to try and figure out what we can safely remove without compromising the normal tissue. So surgery remains important. The more we can remove safely, the more effective the subsequent treatments are. And the more refined all of these treatments have become with technology. They still remain, however, generalized approaches to a disease, so it's still one size fits all.
Right. So at Jefferson, obviously you're one of the sponsors of this Race for Hope, and that weekend of November 3rd, you're then hosting a symposium that medical professionals from all over the world gather for?
Yes.
Is that the way it goes?
So November 1st, it just worked out nicely that way. That's going to be a symposium for physicians, and it's new innovations in brain tumor therapy.
So what are some of the new innovations? Because this is something that, to all of us, it's intimidating.
Right.
And certainly when you're diagnosed, it's one of those horrifying diagnoses for people.
Absolutely. Well, Skip Grossman will kick it off from Hopkins. He's going to talk about how these tumors actually hobble the immune system. And I will
What does that mean?
It means that the immune system's not working right.
Okay.
And it's really a new finding. It was often thought to be a disease, you know, limited to the brain, but it's actually affecting systemically the immune system. And the immune system, not only for this disease, but many cancers, is making an attempt to attack the tumor. But what we're learning more and more about a variety of cancers is that the cancer itself is parrying that offensive. It's neutralizing it. So I will then follow with our new phase 1 trial, which is an immunotherapy trial, which will augment some of what Dr. Grossman is saying. Jean Barnett will be coming from Cleveland Clinic to talk about a very unique and creative way of delivering laser locally to tumors. Ilan Kirsten from Novacure will talk about electricity delivered to the brain 24/7 for years at a time.
Wow.
So patients are arrayed with electrodes all over their head.
That's amazing.
And then finally, a new addition of ours, Mark Hurwitz, will talk about focused ultrasound. So we can take sound energy and focus it in the brain and literally heat a target with
incredible.
MR guidance.
You know, when you look at the brilliant people that you have at Jefferson, and you know, you included, are you know, the talk in the country is Obamacare.
Right.
And the debate in the country, not that I want to talk about politics.
Sure.
But from your perspective in a hospital where you look at innovation, and certainly in America we are innovative, so how does that play with Obamacare, the Affordable Care Act, and all of that? Does that
Sure.
impact this?
Oh, it impacts all segments of medicine. There's no question. You know, neurosurgery, and particularly this disease, is a tiny sliver of the pie of cancer. So it's probably the least affected just by virtue of the sheer number of patients affected. It's considered more of an orphan disease, but it's, you know, it's no less important. In fact, many of the initial attempts by the NIH to understand any cancer have included this disease because it is such a challenge, which really then should elevate it to the status that it does have now. I think the greatest concern I have is funding from the NIH, which is, quite frankly, as we speak, with the government shutdown.
Right.
We have an FDA deadline that we're supposed to be meeting, but we're not sure that they're going to receive it because we don't know if they're even open this week, or the CTEP branch. I think that the crusade against cancer, which Nixon really promulgated, is really being underserved by the NIH, the National Cancer Institute. They are funding very conservative hypotheses that really don't get to patients. So as they've said many times, we've cured cancer in mice for the past 3 decades.
Mm-hmm. Well, you know, I guess in a way, then I'm glad that we're doing an entire show about the works that you are doing and the great doctors at Jefferson, but also the race for hope, because this is, you know, private money coming in. These are donations coming
Absolutely.
in. So one more reason for people to get involved in grassroots campaigns like this to help
Absolutely.
donate,
Yes.
and continue to promote the research and push the government to
Yes.
fund.
Absolutely.
So we're going to have Dr. David Andrews stay right here. You're going to meet some actual survivors, and they have some inspirational stories that you want to hear when the Dawn Show continues.